Doctors had to change the legal definition of death before this surgery could even work. And almost nobody knows that's what happened. Think about that for a second. We're not talking about a new drug, a new tool, or a new technique. We're talking about medicine sitting down with lawmakers and philosophers and saying, the way we've defined death for all of human history is no longer sufficient. We need a new answer. And the reason they needed that new answer was organ transplants. That is where this story ends. But where it starts is so much stranger than that. This is the real history of organ transplants, not the sanitized version you got in school. We're going to go from a 16th century Italian surgeon rebuilding noses out of arm skin, to a forgotten Soviet doctor who beat Boston by 2 decades, to the moment medicine was forced to ask a question it had never had to ask before. When, exactly, is someone actually dead? And the last piece of this, the thing that changed everything, is the part almost nobody realizes was caused by transplant surgery in the first place. Let's start at the very beginning, and I mean the very beginning, because the first thing that looks like a transplant wasn't a heart, it wasn't a kidney, it was a nose. And it came from the patient's own arm. The first book, exclusively devoted to plastic surgery and nasal reconstruction, was written by Gaspare Tagliacozzi of Bologna, Italy, in the late 16th century. The procedure he describes sounds almost absurd until you understand the logic behind it. For the reconstruction of the nose, a flap of skin was cut from the inside of the arm, and the living flesh was placed on the mutilated part of the face and grafted on, so that the two parts would remain in contact for at least 3 weeks. The patient's arm was basically strapped to their face for weeks, while the tissue bonded. It was uncomfortable. It was slow. And by modern standards, it looks insane. But it worked. And the reason it worked tells you everything about where transplant medicine was actually headed. Tagliacozzi wasn't just rebuilding noses. He was watching something that no one at the time had any framework to understand. He had already noticed, centuries before anyone understood immunology, that if you tried to use skin from a different donor, the procedure would fail. The body would reject it. He was observing transplant rejection in real time, without any concept of an immune system, without any vocabulary for what he was seeing. He just knew that the body would accept tissue from itself and refuse tissue from someone else. That observation, documented in the 1500s, is effectively the first recorded description of what we now call immune rejection, and it would take medicine another 350 years to actually understand why it happened. In his book explaining the procedure, he writes, "We restore, rebuild, and make whole those parts which nature hath given, but which fortune has taken away." That's a man who understood what he was doing mattered. It just couldn't have known how far the thread he was pulling would eventually go. Now here's the open loop I want you to hold on to, because we're going to come back to it at the end. Every major leap in transplant history happened because someone was forced to solve a problem they didn't originally set out to solve. Keep that in mind as we go. Fast forward to the late 1800s, and medicine is doing things that, if you describe them today, would sound like something out of a horror script. In 1887, French physiologist Jean-Baptiste Vincent Laborde attempted to revive the severed head of a guillotined prisoner by injecting it with fresh blood. This wasn't fiction. This was a real, documented physiological experiment, growing directly out of serious scientific attempts to understand which parts of the body were actually essential to keeping a person alive. The French Revolution had given researchers an uncomfortable abundance of severed heads to work with, and some of them genuinely wanted to know, is the head still alive after decapitation? Can blood flow restore function? Where does a person actually end? These experiments were disturbing, but the question underneath them was the same question that would eventually drive transplant medicine into its most controversial moment. What does it mean to be dead? They didn't have the answer in 1887. They still didn't have it in 1933, and that matters enormously for what comes next. Because in 1933, in Soviet Ukraine, something happened that most history books skip entirely. The surgeon who performed the first human-to-human cadaveric kidney transplantation was Ukrainian professor Yuri Voronoi. The donor was a 60-year-old man who died of a traumatic brain injury soon after admission to a Kherson, Ukraine emergency room. A single kidney was removed 6 hours after death and transplanted into the thigh of a 26-year-old woman dying from mercury poisoning, and it produced several milliliters of urine before the patient ultimately succumbed 2 days after the transplant. 2 days. Not a success by any modern measure. But here's what matters. In the classic account by David Hume of the pioneer kidney transplants done in Boston, credit was given to Voronoi as the first to perform an allograft kidney transplant in a human being. Even the Boston team acknowledged him. And yet the story most people know starts in 1954 in Boston, and Voronoi barely gets a footnote. Voronoi's historical kidney transplantation was performed in Kherson, one of the regional centers of Ukraine, which is one of the founding republics of the USSR. He was working during the Stalin era, using organs from the recently deceased, doing something Western medicine wouldn't attempt for another 2 decades. The Cold War didn't just separate countries, it separated credit. And before Voronoi, European doctors had already been trying something even more extreme. When human donors weren't available, they used animals. Kidneys from monkeys, pigs, and goats were transplanted into dying patients in attempts to save them from renal failure. This wasn't a 21st century idea that arrived with the pig heart headlines of the 2020s. It was over a century old. Doctors were trying xenotransplantation, grafting organs across species, long before they had any idea how to make it work, because they were desperate. And desperation is often where medicine actually moves. None of it worked. And the reason it didn't work was the same reason Tagliacozzi had noticed in the 1500s without being able to name it. The body knew. It always knew. Something in the immune system recognized foreign tissue and attacked it. And until medicine could figure out how to stop that from happening, every transplant was essentially a race against the clock. And the clock always won. Which brings us to 1954, and the transplant that actually worked, but not for the reason most people think. The famous Boston kidney transplant, performed by surgeon Joseph Murray, is usually described as the moment modern transplantation was born. And in a sense, it was. But the reason it worked is almost never explained honestly. The donor and the recipient were identical twins. On April 3, 1954, the transplant was performed, and the recipient was a 26-year-old patient. But crucially, because the donor was a genetically identical twin, the immune system couldn't tell the difference between the new kidney and the original one. There was no rejection, because there was nothing foreign to reject. It was a loophole, not a breakthrough. It proved that transplants could work when the body couldn't detect the difference, which meant the real problem, immune rejection, was still completely unsolved. Be honest, did you know that? Most people hear first successful kidney transplant and assume it proved the concept was viable for everyone. It didn't. It proved it was viable for identical twins, which is a vanishingly small subset of people who need transplants. The actual hard problem was still sitting there, waiting. And here's the thing. One person who understood exactly how hard that problem was had already accidentally stumbled toward solving a different version of it, decades earlier, through a mistake. Swiss surgeon Theodor Kocher was one of the best thyroid surgeons in the world in the 1880s. He was so good, so confident in removing the thyroid gland completely to prevent disease from recurring, that he didn't realize what he was doing to his patients until it was too late. He started noticing that after radical thyroidectomy, patients, especially children, were developing severe, debilitating symptoms. What he had done was remove a gland the body absolutely could not function without. In 1883, in an attempt to reverse the damage he'd caused, Kocher transplanted thyroid tissue back into a patient who had undergone the procedure. It was arguably the first deliberate tissue transplant in history, and it was born out of a surgeon trying to undo his own mistake. He later won the Nobel Prize. The mistake that led to the fix was part of the discovery. That pattern keeps showing up. Solve one problem, create another, solve that one too. Which is exactly what happened next. And this is the part of the story that almost nobody connects to transplant surgery. By the mid-1960s, surgeons could keep a body's organs alive on a ventilator almost indefinitely. The heart could keep beating, the lungs could keep moving, but the brain could be completely and irreversibly gone. And this created a problem that went far beyond medicine. It was a legal and philosophical crisis. Because under the definition of death that had existed for all of human history, a beating heart meant you were alive. If your heart was beating, you were not dead. You could not be declared dead, and you certainly could not have your organs removed. But a transplant surgeon needs a beating heart. The moment that heart stops, the organs begin to deteriorate. So surgeons were caught in an impossible position. They needed to take organs from bodies that the law said were still alive. In 1968, Publication of the Harvard Committee's report concerning irreversible coma established a paradigm for defining death by neurologic criteria, what we now call brain death. In addition to the traditional way of defining death in terms of the loss of cardiorespiratory function, the committee suggested a new definition of death, brain death, that focused on the loss of neurological function. The report provided a foundation for the eventual adoption of legislation that established brain death as legal death in all 50 states. Medical researchers through the 1960s disputed and negotiated many features of the brain death syndrome, and transplantation interests played a particularly influential role in tailoring the final criteria put forth by Harvard in 1968. In other words, the pressure to make transplants possible didn't just influence medicine, it influenced the legal definition of death itself. The surgery didn't follow from the law changed because of the surgery. That is the thread that runs through this entire history. A nose rebuilt from arm skin in 16th century Bologna. A severed head injected with blood in 1887. A kidney transplanted in Soviet Ukraine during the Stalin era, ignored for decades. A loophole involving identical twins that the world called a breakthrough. A Swiss surgeon trying to fix his own mistake. And then, finally, a committee of Harvard faculty sitting down in 1968 and rewriting what it means to be dead. Because transplant medicine had made the old answer obsolete. Every single one of those moments happened because someone was forced to solve a problem they hadn't originally set out to solve. Tagliacozzi wasn't trying to discover immunology. He was trying to rebuild a nose. Kosher wasn't trying to invent tissue transplantation. He was trying to undo the damage he'd caused. And the Harvard Committee wasn't trying to start a philosophical revolution. They were trying to make organ donation legally possible. That's how medicine actually moves. Not in clean lines. In accidents, corrections, and uncomfortable questions that nobody wanted to ask until they had no choice. If this kind of history is the kind of thing that genuinely surprises you, and I'm guessing it does, because most of us got a very sanitized version of how medicine developed, drop a comment below with the detail that hit hardest. The Soviet surgeon nobody credits? The identical twin loophole? The redefinition of death? I read every comment, and honestly, those threads become future videos. And if you want to see where the story goes next, because xenotransplantation, pig hearts, and what's happening right now in that field is just as strange as everything we covered here, that video is right there. Watch it next. You're not going to want to stop here.